Hey everyone, and welcome to the ComaCast. We thank you for joining us here for another episode. Today is really exciting because Dr. Jake is finally joining us. We've talked
Yeah,
about him
for like
if you've been
probably
on the
2
podcast.
years.
I
Yeah.
know. You finally get to see him if you're watching on YouTube or if you're just listening. Dr. Jake is here. Thank you for joining
Good.
us.
Thank you. Thank you guys for having me. I really appreciate it. I know you guys have been working hard, talking about a lot of different things. And so it's awesome that I'm able to jump on and chat with everybody.
Podcasting from the Lone Star State in Southern California, you're listening to the Coma Podcast with Cody and Matt.
What's fun
Yes.
is, so Dr. Jake and his company actually sponsor a lot of our episodes. So when we talk about him, this is who we're talking about. And so it's super exciting because I have known Jake since I was about 23, you know? So it's really exciting. So we're going to tell you guys a little bit more about Jake and let him tell you a lot more better than I can. So first off, Jake, go ahead and introduce yourself and tell us, how you got here.
Yeah. So I go by Dr. Jake Weinstein, but I am a acute care nurse practitioner, and I have a master's and a doctorate in nursing. And so that's the end of the journey. The beginning was starting out as an EMT and paramedic many years ago.
Yeah.
I won't date myself, but it was a while ago. Still 29, but yeah, I started out as an EMT and paramedic, and then I went to nursing school, and I met Matt when I was transitioning from paramedic to RN, somewhere in that time period. And then I just never left nursing school. I went and finished an associate's, a bachelor's, a master's, and then a doctorate. And then that kind of brings us up to speed to today. It's like a montage of education. So
Matt, is this going to be your future?
Yes. So Dr. Jake was
hopefully with a montage, because it's much easier that way.
yeah. Well, so when I met Jake, he was not done with nursing school yet. He was literally in the middle of his classes, still doing his clinicals, and I had at that time decided this is what I want to do. So Dr. Jake, I've always called him Jake, so I have to like remind myself like when I'm
Just Jake's
talking about
fine
him.
too.
Yeah. So I always kind of look to him for advice. How do I do this? What does this mean? Because there's always a hurdle. I had no idea really what to do. And even getting to spend time with Jake as he was going through this journey did not involve traditional, oh, hey, let's meet up this weekend and go have dinner. Because we did live in the same city for the first, I want to say, year we knew each other in Orlando. We met in Orlando. And then since then, our jobs, our educations, and relationships have taken us literally all over the country. And Dr. Jake would make time for me if he was passing through. He would stop by. I think I even got to hang out with you. You were at a conference, I think, working on either your master's or a doctorate in, I think, DC, which was, I used to live about an hour and a half away. So I went to hang out with him for the weekend and see DC and just hang out with him and just hang out with my friend. And it's so interesting because as I've seen him go through this and going from, an EMT paramedic to a leadership position and just become like, grow into this person, it's like, oh, wow, you're still the same person. We used to go to Chipotle together and just sit and talk and,
We always talk about some of these. We had one of your other friends on last season, and it's fun to see these long relationships that you've had and that they continued on, and what that entails between the two of you.
Right. Well, most of what everybody sees on Twitter is I would say, is pretty accurate representation of me. Jake, would you agree of like what you see
I
on
would
my
say, yeah, I would say so. Yep, that's pretty accurate.
I mean, and
So,
that's right down to like when I'm in a mood versus perfectly cheerful and happy. But I think a lot of people don't see that I do know a lot of my people off Twitter. And for example, Jake and several others that we've talked to, known them for many, many years. Many years at this point. And so, I mean, Jake knew me before I got married to the first time to my ex-husband, like we literally had dinner with Jake the day after, I think it was the day after we celebrated that wedding in that year. Like, I think like 10 plus years ago now. It's a long time ago. But, you know, like Jake has been present for a lot of these milestones that I think a lot of people just don't see. So it's super exciting when he said, I'm going to start this company. I'm going to do this. And I was like, how can we help? I mean, David and I have been David's been a longtime fan and friend of Jake's too. So we were just like, well, how can we support you? What do you want from us? Like, what do you want us to do? So, here's a good point. Jake, tell the nice people, like, what's your company? What do you do?
What I do, yeah. So I started mobile care back in 2016, actually. Um, Back when, I don't know if you remember this, I was doing medevacs. I go back and forth to Dubai
Yes.
and Afghanistan. I pick up patients and I would repatriate them back to the US. Mostly DoD personnel and that kind of stuff, non-enlisted people. So mobile care kind of was at the time was not doing that much. And then a couple years ago, about 3.5 years ago, the company really got involved with a clinic here in Denver that was providing hormone replacement therapy and IV therapy. And I was the provider there for a while. And I saw, well, this is great, and people come here, but I really want to do mobile care. That was the name. It was on the nose for a reason, because everybody wants stuff to come to them. I mean, you can order in Grubhub and Grinder. You can get everything you need in one fell swoop. So
Yeah, you can
why
literally
can't
DoorDash dick and food.
and food? Why not? So
Yeah.
why can't you get medical care to come to your door? It shouldn't be that big of a stretch. Obviously, you can't do everything, but you can do a lot of stuff. So that's what I really started with, and I do concierge care. I go to people's homes. I do urgent care, primary care. I do peptide therapy, testosterone replacement. I do a bunch of sexual health stuff, dick pills. Um, and then I also do some stuff related to COVID. So COVID testing and monoclonal antibodies and a bunch of stuff that's kind of in the moment right now. But most of what I do is uh, hormone balancing for men and women, and peptide therapy, and then um, sexual health and urgent primary care. Even and with telehealth, it's great because I get to see people out of state. And as an NP, it's super easy to get licensed in multiple states. I'm actually licensed in Texas and Wisconsin, Colorado, and I have licenses that are pending in California, New York, and Florida right now, and Georgia. So I'll have those probably in the next, I don't know, couple weeks. I'm just waiting for them to get
Well, when you get that
approved.
Florida one cleared, I need you to text me immediately because
Yeah,
I have a friend that needs help.
yeah. So
Have you noticed, obviously, even before the pandemic, the telehealth was kind of starting to pick up, but obviously the pandemic has like expedited that telehealth and mobile health. Has that been true for what you've seen?
yeah, for sure. So I think one of the good things that came out of the pandemic is people finally realized, like, maybe we should relax the rules and laws around telehealth so we can actually get providers to see people. And so when the laws relaxed, they said, well, you don't need to have a license in Texas to see somebody in Texas. If you got a license in Colorado, you're in good standing. You can treat people in Texas. It's limited, right? So, if somebody over telehealth has some serious issues, they're having crushing chest pain, or they're having some sort of urgent issue, they cut their arm open, like, that's not telehealth.
Yeah.
So
Right.
we can't help you. But for most of what people need, telehealth is great. For like PrEP, for example, is a good one for telehealth. Small urgent care issues. Um, a lot of this stuff can be done over telehealth.
Right, and you guys have heard me talk a lot about the various issues I have, and like I'm pretty open about all of it. I literally talked to Jake about, hey, I got my blood work done, and this is what it looks like. This is what my testosterone looks like. This is a real thing for a 35-year-old guy. Like, this is real, and so I literally do call Jake and text him, and I mean, yes, we are friends, but I go through the same service. I use the service just like everybody else, but we are friends. So, you have that. I think there's that comfort because you're also a gay man, and, my doctor is a straight guy, and there's definitely a huge difference in care. Like I can feel the judgment. For example, my doctor knows, he is also David's doctor, and knows David is asexual. When everything started going wrong with my meds, and I was like, hey, I'm having 5 million symptoms that are compounding, and along with having no sex drive, he's like, well, your husband's asexual. What does it matter? And I'm like,
super dismissive.
I was like,
incredibly dismissive.
well, I too would like my dick to work. His works, he has just different feelings about it. I am not asexual. Like, I need my brain and my dick to sync up. And so, of course, I texted Jake. I was like, okay, what is the appropriate action? Because, you don't want to circumvent the system. You still want, like, just because he's my friend, I'm not going to ask a question that's inappropriate. It's what is the appropriate course of action? He's like, just, okay, log in and let's see. Send me your lab work and I can look at it. So like I said, I go through the same channels as everybody else, but having a gay man as your provider is just a relief because I don't feel that judgment. I don't feel that weirdness. Like you said, the dismissive attitude that is just prevalent in medicine. And that was before pandemic. I don't even know how everybody's doing it now. I cannot believe how burned out everybody is. I would not be offended if I said, hi, I need a Band-Aid, and someone slapped me and told me to get out. You know what I mean? Like, I just wouldn't be offended because I just don't know how everybody's still standing on their own feet.
Yeah, it's not surprising to me because I've experienced it so many times. I think everybody who's gay or who's in the LGBTQ community, and I can't imagine what it'd be like in the trans community. They probably experience it to the nth degree.
Correct.
But I know, even just as a gay man, that when you go to the doctor, you got to go through the whole, like, I'm gay, I like to have sex, and most people, they probably just don't say that, or they probably just say I'm gay and they leave it at that. Most people don't have the level of comfort to say, yeah, I'm gay and I'm into fisting, and I go to a sex party every month and I usually take like 10 loads there. So, and I wouldn't expect people to have that level of comfort with most providers. So, and then that is a huge disservice to the patient, because then you can't help keep them safe if you don't know what's going on. Because it's not that people lie. It's mostly that people just choose not to volunteer information.
Right. I've literally had a doctor tell me, well, I didn't need to know that. And I'm like, well, I'm really sorry, but you're the only person who can fix this, like,
yeah.
But there's also a lot of assumptions that happen. I can recall being at the doctor when I lived in Pennsylvania. And he was like, so I understand that you like to have sex with lots of men. And I said, at the time, I was with my ex-husband and we were monogamous at that time. I was like, no, I have sex with one man who's sitting right there. And, like, James was in hysterics laughing at me. But I mean, and that was a lighthearted moment. But had he not walked in and clarified that with me, who knows, I mean, and that result of that was a massive overdose on an antibiotic, which made me incredibly sick and put me back in the hospital. That didn't need to happen, because he just was like assuming something else was wrong with me that had nothing to do with that at all. But it's not talked about enough. So happy when Jake started coming forward with his company, and it was like, yeah, I'll definitely talk on the podcast. I was like, well, fantastic, because this is a message everybody needs to hear. And having, again, providers that are part of our community stepping out and saying, hey, I'm here, I can help you, let me help you, I think it's a huge service to the community.
It is. And I think patients and I think people should be calling out their providers too. Like, hey, if you don't feel comfortable with me talking about butt sex with you, then maybe you're not the right provider for me, because I want to keep myself healthy, and the best way for me to do that is for you to know what's going on. So, and if you're that person who likes to put lots of toys in their butt, then that's something that you need to tell your provider, because most people don't know, like gay men at least, don't know that they have an increased risk for colon cancer. There's,
Right.
statistically significant things that you should be aware of as a provider when you're treating people in the LGBTQ population. So, and being open and honest about that is kind of the best way for not only the patient, but for the provider too. That way you can provide the best possible care to people.
Right. Well, you also have the whole in the straight community, they just kind of don't talk about a lot of these things. Like I cannot tell you countless numbers, and I'm sure, as a provider, you experience this right up close, husbands and wives who have literally no idea how each other's bodies work. But they literally fucking produce children, and they have no idea how any of it works, so they don't know when something's wrong, or they don't realize they have a problem or are developing a problem, or when it's a take an Advil thing and when it's a, oh, you should probably call the doctor thing. But they have no idea how things work. And
Yeah.
so I think our community gets viewed as hypersexual when in reality it's just kind of forced more out into the open, like, in media and, what you see on Twitter. Because obviously we are not all having porn star style sex every day. But if you do that regularly, this is not a shameful thing. This is not a shaming thing. This is a, hey, let your doctor know, let your Dr. Jake know if you have a Dr. Jake, and tell them so they know to treat you properly and to keep you healthy. One of my things I hope to do is to move forward. Like when you asked me earlier if this is my path, yes, that is actually the path I hope to walk. I hope to join Jake as one of his colleagues many years from now. When I'm done with that, never.
May not
Which
be that
feels
long.
Yeah.
You can do it, Matt.
Yeah.
No, I think that's one of the great things that mobile health, telehealth is really providing for people who are in the LGBTQ community, because they're able to connect with someone like Dr. Jake or wherever, and to have that connection with a provider for questions like this, or for things that are concerning them that they may not have access to at a local level, when it's just coming up with certain questions that they're curious about.
I see people, so I'll see somebody at 10 o'clock at night who doesn't have access to healthcare. Access is kind of a funny word, but who doesn't have health insurance, and and their dick's burning, and they want to get this problem taken care of, and they're okay paying cash, and then a couple hours before, I'll be seeing somebody who's dropping a lot of money to have testosterone pellets placed, or to have an urgent care visit for their loved one, while they're staying in a 4 or 5-star hotel. So and I think the nice thing for me is that I'm able to bring the same level of care to people, kind of across the board. Now, the person at 10 o'clock at night who's doesn't want to wait for urgent care, or doesn't want to wait 2 weeks for Planned Parenthood, which love Planned Parenthood. They're a great organization, but they're so busy. If you
Right.
get an STI in Denver or STD in Denver, it can take, you have very few options. You go to the ER, which I wouldn't recommend
Yeah.
right now. The ERs are a touch busy. And then you can go to an urgent care, which is also very busy. And then you can book an appointment at Planned Parenthood, which is about 2 weeks out right now.
That's a long time to have your dick burn and discharge.
Yes.
And also, I think a lot of people don't realize that if you
You get
suspect something, a lot of those
bacteremic.
symptoms will fade away, and they'll think, oh, never mind, it's better. And it's not. It's just advancing.
Yes. Yeah, it'll get into your bloodstream. So yeah, the best thing is get it taken care of right away. So I do a fair amount of those, especially for people who there's a big segment of the population who doesn't have health insurance,
Right.
but they still have money, and so they're still able to afford care. And I'm actually able to provide really good care at a reasonable cost. So I think, amongst many things, many of the issues is, health insurance companies and their pricing of them is just crazy. It's just, through the roof.
Yeah.
So especially for people who are in their 20s to 40s and don't have health issues. They're just spending a lot of money and not getting a lot in return.
Right. Well, and the things they do need are dismissed, strongly dismissed, when there's an opportunity to give yourself an extra layer of protection, like PrEP, or, checking out, because people don't realize guys can get UTIs, and not just from sex, they don't, because they don't know about their body. And I think mobile care, and you have so much experience, and because you see so many different types of patients, and you started at the EMT paramedic line, you've handled so many levels of care. I think you have such a great platform that you're building for yourself to chime in on the conversation from many different angles and perspectives. And not that, just that you understand it. You've lived these experiences. We're all LGBTQ people living in a straight world. So, that's a perspective that our hetero providers, they don't have that. I mean, even the ones that are just, absolutely wonderful to us and care about us and treat us just fantastically. It's not a life they live,
Right. Yeah.
they
I don't think they know about, well, I'm sure some of them do, but I don't think I don't think any of them ever been to a bathhouse or been to a sex party and seen what's behind the curtain, so to speak, or visited Mr. S. Leather or something like that, where they're like, people do
right.
this stuff.
Like, you type that out on my phone, the ads are already popping, like,
Yeah.
but, I'm being totally serious,
Yeah. Well, if someone is interested in getting in contact with you for mobile care, and they're in one of those states that you're able to, how can they get in contact with you? What's the process?
Yeah, any state really. So,
Okay.
my services, it depends on, so the majority of stuff I can do mobily for anybody in the US, and it's mobilecare-denver.com, mobilecare-denver.com. So I'm sure you guys put a link in the show notes.
Yes.
But if you have, I always do, the consults are all free. People want to talk to me. I do PrEP for people at a very reasonable price. So they can, in the Denver area, they do PrEP that includes an HIV test, a syphilis test, or chemistry panel, and a urine, gonorrhea, and chlamydia test. And it's all for $169 every 3 months.
Right.
So
I had to pay $140 for that at an urgent care in 2010. And that was just, and they were just starting to do clean catch, which is when you just pee. They used to just swab, but now it's clean catch for those. Just pee.
Yes. Well, at least they don't have to stick a swab into your urethra. So
yes,
that's what it used to be, which is no fun for anybody. Well, unless you're into it.
Well, if you're into sounding. But
Yes.
again, if you're into sounding, talk to Dr. Jake. If,
Yes.
for example, just say something, just let him know, let your provider know. And if they're not supportive of you, there are options. There are definitely options. You can get help.
Thank goodness for medical advancements too, so that that doesn't happen anymore, unless you want it.
Right.
Of course, we will put the links to him on our Twitter page and Facebook and everywhere, so you'll be able to link that. Of course, if you have any questions, you can send them our way, and we'll have Dr. Jake on again, and we'll ask him your questions if you want to do it that way. So again, Dr. Jake, thank you for joining us. He'll be back again for another episode soon.
Yes, thank you guys. Thanks for the time. I appreciate it. Thanks for letting me, chat and answer questions. And I'm always happy to help people out. That's what I love to do. I love to help people. So, and there's help for you wherever you are. So just know that.
So, hey guys, we want to remind everyone that you can keep in touch with us on all of our social media channels, whether that is Facebook, Twitter, or Instagram. You can do all of that at the ComaCast.
And we definitely love to interact and hear from all of our listeners. All of this is not possible without you guys.